Well, yesterday and again in the news this morning, you have heard reports about staffing shortages in a state-run aged care facility here in South Australia, and how shortages at night in particular were cited as a reason why restrictive practices were used for people with complex disabilities. It is just one indicator of the significant challenge the aged care sector has at large. Where do you find the people to do the work in the sector? Melinda Salento is the Chief Executive Officer of the Committee for Economic Development in Australia, an independent member-based policy think tank. Melinda, welcome.
Thanks for having me, Rory.
For a number of years, Melinda, your organisation has done a lot of work, I think it is fair to say, looking at the aged care sector. What are your estimates when it comes to the expected shortfall in staff nationwide in the aged care sector over coming decades?
Yeah, Rory, you spoke about what's being experienced right here and now in terms of the challenges of getting enough workers to work in the care sector. We looked at that and looked out long term to sort of see how big a challenge this could be, particularly against the backdrop of a rapidly ageing population. And our estimates are pretty big and pretty scary, I think, potentially up to 400,000 workers that we'll need by 2050 as an identified sort of shortfall. So it's a massive problem. Obviously, we're going to need to pull on plenty of levers, but we think migration already is a part of meeting that need and needs to be a reliable source of workers in the future.
I want to come to migration, if I can, in a moment, Melinda, but let's talk, if we can, a little bit more, because you made that 400,000 additional workers estimate back in 2021 now. What's happened since then?
Yeah, I mean, I think a couple of things. So on the positive front, we've seen a response to lifting wages, and obviously having better terms and conditions in the sector has got to be part of the solution. We know these jobs are actually skilled jobs. They require a lot of experience and expertise, particularly in dealing with, the issues that you identified earlier, the sort of increasingly complex needs in residential aged care. So we do need to, improve terms and conditions. We've seen that through higher wages. That's helped, particularly in terms of reducing the turnover rate, so people leaving the sector. It is a tough and challenging sector to be in. It's got high turnover rates, so that's improved. That probably would help kind of reduce the shortfall, if you like, in the future. But since then, we've also seen growing demand, and we've got the government's reforms before us in the home care sector in particular that are going to lead to increased demands for workers as well. So, I think it's an estimate, but I think it still stands the test, to be honest, in terms of, the quantum of the workforce we're going to need.
And just a reminder, those reforms, they're now less than a month away.
Yeah.
After being delayed.
Yep.
So they are very much front of mind for lots of people in the aged care sector. Okay, Melinda, let's talk, if we can, about potential solutions. From your organisation's perspective, what could the federal government do?
Yeah, I mean, I spoke before about the need to make sure we've got improving terms and conditions, and I think one of the things that we've identified is that you do need to make this a profession that's attractive and properly remunerated. But even if we do that, we still rely on a migrant workforce as well. That's the case now. We've got about 1 in 6 workers who are working in the sector on temporary visas. We identified the need for what we would call an essential skills visa. So a pipeline, if you like, of qualified, experienced aged care workers and care workers broadly who can have an easy pipeline into the Australian workforce, and employers having an efficient and effective way of identifying potential workers to bring in quickly and efficiently. So we've been advocating for an essential skills visa. We think there's a strong argument for it and ways in which we can do that to ensure that we get the right workers in.
Okay, so how would that be different to the current regime?
I think the government in its own migration strategy identified the importance of having a pathway for essential workers, particularly in the care sector. What they did is develop a labour agreement approach, so an approach that sees employers reaching a memorandum of understanding with the unions, and then going through a process of labour market testing and bringing workers in that way. The research that we've released this week has shown, through our consultation with employers and businesses in the sector, that this just isn't really working for them. It's taking a long time. It can take up to 12 months to negotiate one of these agreements. And what we're seeing is that 9 out of 10 workers that are being employed on those through those labour agreements, who are migrant workers, are actually already in the country. So, the idea that we're going to grow the workforce that way is shown to not be working. And so, I guess what I'm saying is the government's identified that they support a pathway. They've tried one approach. We've shown that approach isn't working. So what we're putting forward is a streamlined visa process that would allow us to bring in more workers in a way that's timely and less costly for business.
That is the voice of Melinda Salento, who is the Chief Executive of CEDA at a national level. It is 25 minutes past 10 here on the morning's program. Thank you to this text from Dave. From memory, over 10 years ago, Bernard Salt, a demographer, was warning us that the service industry would be needing an enormous amount of people, but we just didn't listen. Only immigrants seem to fill these jobs. Australians do not want to. I speak from experience. I'm a participant on the NDIS. Another text here on the other side of the argument: migration is not a solution. Every person who migrates here gets old. Many of them are brought in with their families so that the worker and their families get old, so the problem just gets bigger and bigger. Kerry joins you now. Hello, Kerry.
Hi, how are you? Look, I've wondered about the effect of agencies on staffing, but there seem to be a lot of people working through agencies, and they get paid a lot more money if they get hired out on a temporary basis through an agency. And so I think there are probably a lot of people that are available, but they just go for the extra money, which is fair enough. And I'm just wondering, how much of an effect these agencies have on our proper staffing levels.
Kerry, thank you very much. Yeah, there's lots of agency work, not just in the aged care space, but also across the health sector broadly, in nursing, I think of in particular. Back to you, Melinda, to sort of pick up on a theme of one of those texts there. Isn't the aged care workforce already heavily reliant on migrant workers?
Yeah, yes, it is. And if I can just I'll respond to the point on the agency work as well,
Sure.
if you like.
Sure.
I mean, I think the fact of the matter is that agencies do provide a valuable resource into the sector, and particularly when you need staff quickly. So if someone calls in sick and the like, and so there is flexibility that's afforded through those agencies, and there's reasons why they pay higher wages. But I think the fundamental point is, like, having to rely heavily on agency staff isn't good for the commercial model, quite frankly, of aged care either, because obviously it's a pretty tough business. Everyone's really struggling to sort of make ends meet across the sector, to be honest. So what we need is a sustainable, stable workforce that can be relied on. And as I said earlier, we do need to look at the terms and conditions in the sector to make it attractive. We need to, really commit to building careers in the sector as well, so that it becomes a viable career for people. But yes, we do. We already have a significant proportion of that workforce who are migrant workers. And I think as we've got a growing demand in the future, it is going to have to be one piece of the puzzle. Those workers do get older themselves, but at the moment, I think we talk about the baby boomers. It's a for want of a better, more eloquent description, it's a bulge of people at a particular demographic that's
Tidal
working
wave
through
even.
our system, and we've on. The workforce that's going to to service them is a smaller workforce. So we're just going to have to figure out how we make this work year in, year out for the next 25 years, honestly.
Picking up on another sort of theme coming through on our text line here, 0467 922 891 is the number if you do want to take part in this conversation. Melinda, what do you say to people who would argue that setting up, say, a specialist visa program for skilled migrants would fuel other pressures that the nation is facing?
Look, I think there's obviously concerns around, demand for housing and the rest of it. We've always been advocates for having a sustainable, predictable, long-term approach to this. So this isn't about creating a visa stream that's going to bring in a huge number of people overnight. What we actually want is a system that we think works predictably and efficiently and works alongside the domestic education and training system. At the moment, we've got people coming in, as spouses, as students, who are then coming into the sector. And what we'd like to see is we're bringing people in with the skills and expertise that the sector needs. So I understand the concerns. I think if we do this strategically and with an eye to the long-term workforce needs, that we can do it in a way which is going to be understood and supported by the community who are concerned about how we're going to meet the care needs of their parents and their grandparents.
Melinda, where are you at with your conversations, if you can, bring us in on this, with the federal government about this? Have you had any direct conversations with the Commonwealth?
Yeah, we have, and we're part of the process that's working through with the government around how we can implement some parts of their migration strategy. As I said, they have themselves supported an essential skills pathway. They've introduced these labour agreements. We've been upfront with them and saying we don't think they're working based on the conversations that we have with our members. I think that they understand they want the system to work well. The government wants to see their aged care reforms and the support at home reforms work and deliver the outcomes needed, and workforce is critical to that. So I think they're open to hearing what we've got to say, but we've got to find a solution that builds confidence that we're bringing in the right workers, that they're not being exploited, and all of the reasonable concerns that people would have.
Melinda Salento, the CEO of CEDA, thank you for joining us this morning.
Yeah, thank you so much.